High blood pressure. What is high blood pressure? High blood pressure, known as hypertension, is a frequent condition, which is the force of blood pushing against a person's blood vessel walls as the heart moves blood throughout the body may cause health concerns such as heart disease, where the long-term force of blood against the walls of your artery is large enough. Both the blood volume and resistance to the blood flow of your arteries determine blood pressure. The greater your blood pressure, the more blood your heart pumps and the narrower your arteries. A reading in millimeters of mercury of blood pressure is given, mmHg. It has two numbers. Top number, systolic pressure. The first, or upper, number measures the pressure in your arteries when your heart beats. Bottom number, diastolic pressure. The second, or lower, number measures the pressure in your arteries between beats. Years without symptoms, you can have high blood pressure. Uncontrolled hypertension raises the risk of significant health complications, such as heart attack and stroke. Fortunately, it can readily identify elevated blood pressure. And you may work with your doctor to treat high blood pressure once you realize it. Symptoms. Even if blood pressure measurements reach a dangerously high level, most persons with high blood pressure have no indications nor symptoms. A few people may experience high blood pressure with dolences of their head, shortness of breath or nosebleeds, but these symptoms and signs are not particular and typically do not arise until a severe or life-threatening level has been achieved. Causes. There are two types of high blood pressure. Primary, essential, hypertension. There is no recognizable cause of elevated blood pressure for most persons. The form of hypertension, known as primary, important, tends to develop over several years. Secondary hypertension. Some people have an underlying ailment due to excessive levels of blood pressure. This high blood pressure kind, known as secondary breathing, suddenly tends to be higher than primary hypertension and causes greater blood pressure. Various conditions and medications can lead to secondary hypertension, including obstructive sleep apnea, kidney disease, adrenal gland tumors, thyroid problems, certain defects you're born with, congenital, in blood vessels, certain medications, such as birth control pills, cold remedies, decongestants, over-the-counter pain relievers and some prescription drugs. Illegal drugs, such as cocaine and amphetamines. Risk factors. High blood pressure has many risk factors, including age. The risk of high blood pressure increases as you age. Until about age 64, high blood pressure is more common in men. Women are more likely to develop high blood pressure after age 65. Race. High blood pressure is particularly common among people of African heritage, often developing at an earlier age than it does in whites. Serious complications, such as stroke, heart attack and kidney failure, also are more common in people of African heritage. Family history. High blood pressure tends to run in families. Being overweight or obese. The more you weigh, the more blood you need to supply oxygen and nutrients to your tissues. As the amount of blood flow through your blood vessels increases, so does the pressure on your artery walls. Not being physically active. People who are inactive tend to have higher heart rates. The higher your heart rate, the harder your heart must work with each contraction and the stronger the force on your arteries. Lack of physical activity also increases the risk of being overweight. Using tobacco. Not only does smoking or chewing tobacco immediately raise your blood pressure temporarily, but the chemicals in tobacco can damage the lining of your artery walls. This can cause your arteries to narrow and increase your risk of heart disease. Secondhand smoke also can increase your heart disease risk. Too much salt, sodium, in your diet. Too much sodium in your diet can cause your body to retain fluid, which increases blood pressure. Too little potassium in your diet. Potassium helps balance the amount of sodium in your cells. A proper balance of potassium is critical for good heart health. If you don't get enough potassium in your diet, or you lose too much potassium due to dehydration or other health conditions, sodium can build up in your blood. Drinking too much alcohol. Over time, heavy drinking can damage your heart. Having more than 1 drink a day for women and more than 2 drinks a day for men may affect your blood pressure. If you drink alcohol, do so in moderation. For healthy adults, that means up to 1 drink a day for women and 2 drinks a day for men. 1 drink equals 12 ounces of beer, 5 ounces of wine or 1.5 ounces of 80-proof liquor. Stress. High levels of stress can lead to a temporary increase in blood pressure. Stress-related habits such as eating more, using tobacco or drinking alcohol can lead to further increases in blood pressure. Certain chronic conditions. Certain chronic conditions also may increase your risk of high blood pressure, including kidney disease, diabetes and sleep apnea. Sometimes pregnancy contributes to high blood pressure as well. Although high blood pressure is most common in adults, children may be at risk, too. For some children, high blood pressure is caused by problems with the kidneys or heart. But for a growing number of kids, poor lifestyle habits, such as an unhealthy diet and lack of exercise, contribute to high blood pressure. Complications. High blood pressure can harm your blood vessels and your bodies through overpressure in your artery walls. The higher and more unregulated your blood pressure, the more harm it does. Uncontrolled high blood pressure can lead to complications including a stroke or a heart attack. High blood pressure can lead to a heart attack, a stroke or other issues, and can cause hardening and thickening arteries, atherosclerosis. Aneurysm. Increased blood pressure can weaken and bulge your blood vessels, resulting in aneurysm. It can be life-threatening if an aneurysm breaks. Failure in the heart. The heart must work harder to pump blood against increasing pressure. This makes the pumping chamber of the heart walls thicken, left ventricular hypertrophy. Finally, it might be difficult for thicker muscle to pump enough blood to fulfill the demands of your body and result in heart failure. The blood arteries in your kidneys weakened and constricted. These organs can be prevented from working normally. Blood vessels in the eyes thick, torn. This may lead to loss of eyesight. Metabolism. This syndrome is a set of metabolic problems, including enlarged waist circumference, high triglycerides, low HDL cholesterol, high blood pressure and high insulin levels. These factors make diabetes, heart disease and stroke more likely. Memory or comprehension problems. Uncontrolled hypertension also may influence your thinking, remembering and learning skills. Memory problems or notions of comprehension in persons with high blood pressure are most prevalent. Controversy. Enclosed or obstructed arteries can reduce brain blood flow, resulting in a specific kind of dementia, vascular dementia. Vascular dementia can also result in a stroke that blocks blood supply to the brain. How can I lower my blood pressure? You can take several steps to reduce high blood pressure. Lower your salt/sodium intake. Get active. Move more by exercising regularly, around 30 minutes per day, 5 days a week. Keep at a healthy weight. Eat healthily, choose fruits and vegetables over sugary snacks and fatty foods. Consult your doctor or healthcare provider for additional tips suited to your needs. Manage stress and anxiety in your life.